Okay,
Yep.
perfect.
Yep.
All right, go ahead and start.
Yep. Okay, so let's
Hello.
get on.
Wait.
Is what is breast cancer and how does it develop?
Okay, so that's a very good question. So, just like in general, what happens in a cancer, what makes cancer occur or how does it develop, is that there's usually a mutation that's causing cells that are normally there to now replicate or expand more than they're supposed to. So we all have, women have, men and women actually have breast tissue, and we have usually these checks and checkpoints where we know to stop, like the cells know when to stop growing, how much we need in that area, and they have uh, inhibitors to know like when we don't need to grow anymore. In cancer, generally, what's happened is that checkpoint, that stop point to know when that cancer cell should stop dividing, a normal cell should start dividing, has been lost. And now we are having extra exponential growth. And that will become like in a solid tumor like breast, that'll become a lump, or actually in the very early stages, it can show up as calcifications. And then slowly, as those cells are growing and clustering into together, it becomes larger and larger, it can turn into a mass and whatnot. So I would say like it's a really like difficult question actually. What causes cancer? Like what's the mechanism behind it? But it's basically uncontrolled growth of a particular cell. And that kind of applies to all cancers, even like hematological malignancies like leukemias and lymphomas and myelomas, is that there's one cell that's gone haywire and it's growing beyond what it's supposed to do.
Okay, our second question is, what are the risk factors for developing breast cancer?
Mm-hmm. So that's a good question. So, there are hereditary forms of breast cancer, but those are very actually uncommon. Maybe less than 20% of breast cancers are hereditary. They come from your family. Like there's a mutation in your family, or even, a known mutation that we test for, or there are other unknown sort of hereditary breast cancer. So that's one risk factor, is having family members that have had breast cancer before. Also, women that have what they call unopposed estrogen. So having, like, for example, some of the criteria for who's considered at high risk for having breast cancer is any woman who has not had a baby by the age of 30, because you have estrogen constantly cycling in your body. So that's called nulliparity. And basically, if you have not had a break in your estrogen cycling for 30 years, you're at higher risk than somebody who's not. Um, and they're looking into things like diet and uh, obesity related. So in estrogen positive breast cancers, patients that are overweight tend to have a higher risk. But that's not to say that people who are not overweight and don't have family history don't get breast cancer. That's the mystery behind breast cancer. Why did it happen in the first place? But so we talked about hereditary, we talked about estrogen, having estrogen exposure, and also fat, unhealthy diets. So those are some of the things that I can list off the top of my head.
And can breast cancer be prevented? And if so, how?
So that's a really good question. I think they're looking at to see what can be done. Um, there aren't too many like really preventative types of studies. But they have said that once a woman has breast cancer, to how to prevent it from coming back. So let's say you're a young female cancer and was estrogen positive, then we'll continue to say uh, high fiber, healthy diet, lean body weight, less fat. Those things are preventative. But in general, like the general population, since we don't really know one direct cause of it, like for example, in lung cancer, a lot of lung cancers we know are caused by smoking. So we can say, okay, don't smoke, and that's going to help you decrease your risk of breast cancer, of lung cancer. In breast cancer, we don't have any one known cause that we can just say, okay, avoid this. But generally, like we tell women that, be staying healthy, eating, and there was a study just this last year that said that women that have increased fiber intake have less risk of a recurrence. So lots of fruits and vegetables and antioxidants will be helpful.
Okay. So what are the common signs and symptoms of breast cancer that individuals should be aware of?
Okay, very good. So I think that in general, if so there's some conflicting data as to whether a breast exam, like doing a full your own self breast exam, women who do those, whether it's helpful or not. I, as an oncologist, will tell you that's a lot of times how patients find their own breast cancer. So if they were to feel a lump on a breast exam, if they were to see like drainage from their nipple, if they ever saw the skin around the nipple being pulled, and there's something called peau d'orange, which looks like the skin around the breast looks like an orange peel. That's how it gets its name. It's where something underneath in the breast tissue is pulling at the skin and creating these little dots, like how an orange looks, has these little round indentations. So those are signs of to watch out for. If you felt a lump or mass or anything in the breast or in the underarms, the axilla, or in the right above your collarbone, the supraclavicular area. So those would be signs and symptoms, but we're not going to wait till we see those. We're going to recommend that every woman age, I think this might be a question. So I think you guys were going to ask me, like, what is the recommended screening for breast cancer? I'm sure that I'm jumping the gun, but so those signs and symptoms you can watch out for, but that's usually like something, it shows us that it's already advanced. So what we're trying to do is detect breast cancer early before they develop any of those signs. So the recommended screening for breast cancer. So how do they come up with what's a good screening test? A good screening test is one that you're going to detect the cancer early so that you can offer curative treatment, meaning you can completely cure that person of cancer. So something that's going to detect it early enough for you to be able to get curative treatment. And so the recommended screening test is a mammogram starting at age 40 for most women, and to have it a yearly mammogram. And so what that's going to pick up is if there's any abnormalities in the breast tissue, that would then further prompt them to do further testing like ultrasound and biopsy. But to answer your question, yes, those would be concerning signs that patients should go and see their doctor right away.
And what are the different stages of breast cancer and how does the stage affect treatment options?
Okay, very good question. So it goes from stage 0 to 4. Okay, what is stage 0? Stage 0 is that you have found it before it became invasive. That is called ductal you can have two, but it's called in situ, INSITU. So in situ cancer is considered stage 0 because you found it before the cell had a chance to break through what is called the basement membrane of a duct to become invasive. And so in that case, stage 0 cancers usually just require removal of the tumor, and sometimes will require radiation, and sometimes will require hormone blockers, depending if those were present on the tumor. Stage 1 will be that the tumor is small. It's usually less than 2 centimeters, and it has 0 lymph nodes. And stage 2 will be that it is between 2 and 5 centimeters, I believe, and 0 lymph nodes. And stage 3 is lymph node positive, that it had gotten a chance to go from the breast tissue into the lymph nodes, which is usually in the underarm, the axilla. And then stage 4 is the highest stage of cancers. It means that it's gone from the original tumor, from the original site, to a different part of the body. And so that could mean that it's gone to a distant lymph node somewhere else, or it's gone into the lungs, the bones, the brain, the liver are the most common sites of metastasis. That's called, stage 4 is called metastatic breast cancer. And the treatments, how do they change? So I told you about stage 0 to, I would say, 3. You usually are doing surgery, radiation, hormone blockers, and possibly chemo. And now who gets what kind of treatment is usually a very complex discussion, and it's based on the size, the lymph nodes, if cancer was present in the lymph nodes, and also the tumor biology. So if it was estrogen positive, so there are 3 receptors on the breast tissue that we are most interested in. One is estrogen, one is progesterone, and the third is called HER2. Based on the markers on the tumor cells, we try to decide if the person needs, they all need surgery up to stage 3, but whether they're going to need radiation, chemo, and hormone blockers all depends on those markers on the tumor, the lymph node status, and now we also know a little bit about the genetics of the tumor. In fact, there's a test called Oncotype. It's really interesting. It takes the tumor cells and looks at 21 genes that might be present in tumor cells. Based on whether the person has those genes inside the tumor, if the tumor has those genes, it gives a score. It's called a recurrence score. And we have low risk, intermediate risk, and high risk based on the score. And we decide whether somebody should get chemotherapy based on that score. That is for the estrogen positive breast cancers. If somebody has a HER2 positive breast cancer, we don't use the Oncotype recurrence score to help us decide, because generally those patients do need chemotherapy. As long as it's 0.5 centimeters and above, most patients are going to get chemotherapy. So there are 3 kinds of breast cancers. One are estrogen positive breast cancers, one is HER2 positive breast cancers, and the third kind is triple negative, meaning they don't have any of those 3 receptors. The HER2 positive breast cancers and the triple negative breast cancers are the highest risk. They have the highest risk of it coming back, even if you remove them. So that's where usually we need chemotherapy involved, some combination of chemo, surgery, plus or minus radiation. Now, some of those tumors are large enough, usually 2 centimeters and above, or they have lymph nodes positive, that we are actually starting with chemotherapy and then going to surgery. So it becomes a little bit more complicated discussion once the tumor is large, lymph node positive, or it's one of those cancers like the HER2 positive and the triple negative. Otherwise, if we're dealing with a very small tumor or even stage 0 breast cancer that's estrogen positive, the treatments are are easier, meaning that it's usually surgery and some kind of hormone blocker and plus or minus radiation. So so that kind of is a very, I could probably give you like a 3-hour lecture on that question, but I won't. But generally, does that give you guys a good idea of how we decide who needs what? Okay.
Yeah.
Did you guys have questions more about anything there that didn't make sense?
No, it's okay, yeah.
It kind of makes sense?
Yeah.
Okay, good.
All right. Are there any recent advancements or breakthroughs in breast cancer treatment?
Oh my gosh, there's advances and breakthroughs in breast cancer treatment every day. Almost like every day we are getting some new piece of knowledge that's helping us fight this. And just within the last year, off the top of my head, I want to say that there's like 3 new drugs that weren't there before. And so this is the really exciting part of oncology. Of course, it can be very sad when patients come in with very advanced cancers and we know they're not going to do well, that they're probably not going to get curative treatment. That I'm talking about like stage 4 cancers. But even for those patients now, there are new drugs that weren't there even a year ago. And they're studying all those things that you guys were asking me about, like what are ways to prevent breast cancer? What are good screening tests? What are good drugs that are available for cancer once it develops? So I would say it's like actually one of the cancers that we have the most active research in. So being an oncologist, you know, you really sometimes get these really sad cases that people have very advanced cancer and we know we can't cure it. But the very uplifting part of it is there are new cancer drugs being developed like every day almost. And it's a long, hard process. Researchers are working and sometimes dedicating their whole lives to come up with one drug. But at the end of it, if it helps even one person, it's helpful. It's, you know, worth it.
How important is early detection in improving breast cancer outcomes?
It's the most important thing that we can do. Because once we get to stage 3s and 4s, the curability rate is a lot lower. So if we can find cancers in stage 0 to 2, even 3 is still curable, but the chances of it being curable gets less and less as you are going up further in the staging. So early detection can really save lives in breast cancer. We know so many people that have been diagnosed with breast cancer, but they had it treated early enough and it never came back. So they're living their entire lives as if, you know, it didn't hinder them from living out their lives without, you know, difficulty.
What support and resources are available for individuals diagnosed with breast cancer and their families?
Yeah, that's good. So American Cancer Society offers a lot of helpful resources on their website. And I would say that, and they offer a lot of programs. For example, they used to have this program, I don't know if it's still running, it was called Look Good, Feel Good. So women that were going through chemotherapy and they lose their hair, they would help them come up with ways to, you know, still look good and feel good about themselves, for example. Also, American Cancer Society offers like wigs to women who are losing their hair because of chemotherapy treatment. But it also offers like a lot of advice and support groups. And then I think individually, like for example, Emory Winship, where I work, has breast cancer support groups. So what are those? Those are basically like just patients that get together to discuss what's going on, maybe former patients, you know, to discuss side effects, ways to cope with some of the side effects. So I would say those would be my go-tos when I'm, you know, recommending something to my patients. It's like the American Cancer Society, but also our individual programs through our social worker. She can usually hook the patients up with like a support group that could be helpful to them.
And can you explain the importance of regular mammograms?
Oh, yes, I can't emphasize it enough because I don't know I have any statistics in front of me, but you guys can probably research some of the statistics of how many breast cancers are diagnosed early. So you maybe, you know, stage 0 to 3. And so that's the most important thing about mammograms is that is our tool for early detection, which is going to find cancers early enough so that we can cure them. So I can't emphasize enough how important that is. And then I think that if some of the hurdles that patients run into, like barriers to getting early detection, getting mammograms, is one is just fear. They're afraid to go because I don't know, fear of the unknown, I guess. And maybe sometimes also fear that it's a painful procedure. I mean, it's uncomfortable, but I wouldn't say necessarily really painful. So mammogram, that's one of the barriers. The other is lack of insurance, right? In our communities, in the US, if you don't have insurance, you don't have access to good healthcare. So looking up, I would say there are resources out there for getting mammograms in patients who don't have insurance coverage. For example, I actually volunteer at a clinic for uninsured, and they have a program through Northside Hospital where they're getting free mammograms. And then once if they have an abnormal one, then Northside is actually paying for their workup. There are also like mobile mammogram units that go around. So really, in this day and age, at least in the area that we're in, I would say there shouldn't be any, situations where women can't go get their screening mammogram. But I know we're still working on it. Trying to get everybody health insurance is not an easy task.
Yeah, so are there any lifestyle changes that can help reduce the risk of breast cancer?
Yeah, so I would say a healthy diet with fresh fruits and vegetables, which also have antioxidants, exercise. So there's been studies that people who generally exercise at least 3 to 4 times a week can reduce their risk of cancers. Alcohol intake, I can't tell you specifically what the recommendations are, but excessive alcohol intake can also be harmful. So reducing alcohol intake. And I think those would be the ones I can come up with. Yeah.
How can individuals be proactive in their breast health?
So we talked about breast exams, self-breast exams, annual screening mammogram, and then getting to a doctor if they did notice something on their breast exam, not to delay it.
What roles do genetics play in breast cancer, and when should genetic testing be considered?
Okay, that's a good question. So there's a hereditary breast cancer syndrome. It's a hereditary breast and ovarian cancer syndrome that's related to a specific gene called the BRCA gene. It's usually recommended to have any woman age 65 and below. Actually, I think that's changed. It may have changed to 50. Hold on, let me tell you exactly. So either you have a high family history, a significant family history, several first-degree relatives that have had breast cancer, and or you yourself have been diagnosed with breast cancer. You should have the genetic testing done. Let me tell you exactly. Because it used to be an older age, but I think they've changed it. And it's really interesting because we actually have drugs that can target those genetic mutations now. So it's even more important now. We are checking pretty much most patients with breast cancer for these genes. So I'm going to come back to that. Okay, so it's still not giving me any. The strong family history and a personal history of breast cancer. I would just say that if it's age less than 50 for estrogen positive breast cancers, and age less than 65 for the triple negative breast cancers. And then there are certain ethnic groups that are at more risk for breast cancer, and especially the genetically mutated breast cancers. So a big group in that is the Ashkenazi or Eastern European Jewish group, that they have a higher risk of having those genes. So you'll see that sometimes in the criteria for who should get tested. So even if they're older, past the age that we're saying, sometimes they're actually qualifying to get the testing done. Also, there are some studies to suggest that African Americans tend to have a more aggressive breast cancer. So there's usually, not genetic testing specifically to them, but early screening is really recommended, because the type of breast cancer that we see more often in African American women, especially younger African American women, is triple negative, and that tends to be very advanced even on diagnosis.
Okay, and then are there any misconceptions or myths about breast cancer that you would like to address?
Yeah, one of them is that men can't develop breast cancer. Have you guys ever heard that? Do you think men can develop breast cancer?
Yeah, can.
They can.
Yes.
Yes, and it's very unusual. If obviously it's not common, as nearly as common as for women, but so I would say for men to also be aware of their body, and I don't know how often they're going to do self breast exam, but just knowing if they felt a lump, a bump in their breast tissue or even in their underarm, that they should seek care right away. Let's see, what other myths or misconceptions? That only family history. Let's say a lot of people come in and say, well, I don't have family history, so I don't think I need to go get a mammogram. That's a big misconception, because I told you 80% of breast cancers are not hereditary. You could have 0 family members that have had breast cancer, but you now do. And it probably has something to do with our environment. Things in our environment that are causing it. We just don't know exactly what it is. Let's see, what else? That mammograms are very painful. And I don't think that that's necessarily true. They're uncomfortable, but for the 20 or 10 to 20 seconds that you're there, otherwise it's a pretty easy, non-invasive, risk-free type of procedure.
All right. So how can individuals and communities support breast cancer research and initiatives to improve outcomes and quality of life for patients?
So that's good. I think that in communities, especially, I think in our South Asian community, patients and people, just people who we think would know better, they are not going for their mammograms. So maybe emphasizing in our communities, like what you guys are doing, being aware of breast cancer, knowing when you should start screening, and know what the screen is. And once a breast cancer is detected, knowing what the steps are. But I think generally, like when somebody's diagnosed, they have like proper, pathways to get them to the right people, get them to a surgeon, get them to an oncologist, and whatnot. As far as breast cancer research initiatives, I think it's great, if communities can come together, raise money for a cause. You guys have maybe heard of different organizations, like Susan Komen is one. There's one called Relay for Life, which is the American Cancer Society puts together an event. Does Lambert participate in that?
I
No.
don't think so.
We should start that next year. Like, get Lambert to participate in the Forsyth. Maybe you guys can look up Forsyth County Relay for Life. And it's a big event. The biggest one is Gwinnett County. I used to do it there. But all the high schools actually participate, and the high school team is usually raising money, and all that money goes to American Cancer Society, which goes towards research, patient support. And American Cancer Society has a program that's called Road to Recovery. And what it does is it provides transportation for patients who don't have transportation to their appointments. So you guys can look into that. That's actually something that maybe if you started that as a group through HOSA, through Lambert, that could be wonderful. And I'd help you guys if you needed help there. Yeah.
Yeah, those are all the questions we have so far.
Okay. When you think, okay, good. So I think we covered a lot. Trying to think if there's anything else. Anything just off the record or something that you wanted to ask that's not in your list? Something you thought of while we were talking? Trying to think.
No, you pretty much answered everything along the way.
Thank you.
Oh, you're
Yep,
very,
thank you for your time.
Yeah, thank you.
Thank you
course.
so much for your time.
If you think of questions, let me give you my email too, just in case you want to send me any questions. Really my personal one, because the work one will just go into a junk box. So it's nhan, KHAN 125 @gmail. So if you think of questions, let me know. Let me know how your presentation went too.
Yep.
Or if later you guys want to
Thank you
work
so
on
much.
building a relay for life, let me know too.
Yeah,
Okay.
definitely.
All right.
Mhm.
Great. All right, you guys have a good Saturday. It's gloomy outside. Hopefully indoor. All right,
Thank you.
take
Yeah,
You're
thank you.
welcome.
Thank you.